We need to find a way to get in good trouble, necessary trouble, if we're going to save America.
This is Keri. Welcome to the Necessary Trouble Show. Here's your host, my dad, Russell Fugett.
Welcome back to the Necessary Trouble Show here at Good Word Digital Studios. I'm very excited today for this wonderful team of amazing women who are doing some very important work and research in the area of maternal health disparities at Tufts University. Today, I'm joined by Dr. Keri Carvalho, Brenna Miller, who's an MP Master's in Public Health candidate at Tufts University, Kelechi, who's also a student at Tufts, and my friend, Dr. Ndidiamaka Amutah-Onukagha. Thank you for joining us, ladies.
Thank you for having us. Thank you so much. It's a pleasure to be here, Russell. And thank you to everyone from the Mother Lab.
I was so excited when you posted on Facebook. I know it's been 15 years since we've seen each other. Yeah. And I was just, which blew my mind. I thought it'd been more like 10 or 12. And I was so excited. And as Crystal was telling you before we got on the air, we did an episode talking a little bit about health disparities in maternal health, particularly as it relates to Black women. And so I'm so excited we're able to make time for you and part of your team to be on today. Tell us a little bit about how you began your research into Black maternal health disparities that led you to the creation of the Mother Lab.
Sure. Good morning, everyone. So my background in maternal health disparities kind of is steeped in my childhood and how I grew up. I grew up in Trenton, New Jersey. My parents are immigrants from Nigeria. And growing up in an urban environment that was under-resourced, but also understanding, before I formally knew what the social determinants of health was, I knew that there were different communities that were adjacent to ours that had more resources, better opportunities, better schools. And I just remember thinking, well, why do they have computers and we barely have books, right? And so that was the beginning of my curiosity around health disparities research. And then fast forward, I went to Rutgers University for undergrad, coming out of a high school class of an incoming freshman class of 1,100 students, but a graduating senior class of 400 students, right? And so really losing 700 students in the course of 4 years. Some people were in jail, some people were dead, some people dropped out, had kids. And so that felt very much a loss of talent and resources at such a young age. My first introduction to maternal health disparities, which at the time I didn't really my teenage mind couldn't really conceptualize it, was when one of my girlfriends, Waikia Moore, may she rest in peace, Waikia had delivered her daughter at the age of 15, who Jamira just graduated from college now. She's going to be a lawyer. And she had some complications related to her delivery, and she actually died. And as a 15er, I think I was 16 at the time, going to her funeral, I just remember feeling, this is abnormal. Like, she's 16, like she was 15 at the time. And so, she had lupus and she had complications from lupus. But if she had been in the right type of trauma center, if they had really paid attention to her symptoms, if they had taken her life and her illness as a priority. I remember going to see her in a hospital right before she died. And she was like, I'm just so tired. And, that fatigue is a symptom of lupus. And so just being in an under-resourced community, we know that Black women that deliver in Black hospitals are more likely to suffer complications and maternal mortality. That was really pivotal for me as a teenager, to be at a funeral of a 15-year-old and for her to have a brand new baby who never got a chance to know her mother. So that was what happened as a teenager. And then fast forward, went to college, right? Did my master's, GW, did my PhD at University of Maryland, right? In maternal and child health. Now I'm working in Baltimore. I'm doing a postdoc. And guess who I'm working with is Dr. Shalon Irving. May she also rest in peace. Another Black woman that died from complications. And so we had a really pivotal event in my childhood, a close friend of mine. Now, 15, 20 years later in my adulthood, she's a doctor, I'm a doctor. She had a really senior position at CDC. Her death got national attention because it was completely preventable. She died from complications of preeclampsia, right? She had high blood pressure, her organs started to shut down. She had been seen in home by a nurse, a visiting nurse, but by the time they readmitted her, this was down in Atlanta, by the time they readmitted her, it was too late. And so now her daughter is also growing up without her mother. And so these two kind of events in my childhood and then in my professional career totally preventable Black maternal deaths have really just solidified for me why this is my life's work. And also as a Black woman, I would be remiss not to be able to use the training, the lived experience that I have to further this work on a local and national scale. And so that's really the impetus for why I do the work that I'm doing at the community and in the research space.
Tell us a little bit about the causes of some of these inequalities. And of course, I know the story that also got a lot of news earlier this year was Serena Williams.
Yes.
Who, a world-class athlete, all the money, you would ever need to, get the best healthcare. And still, barely survived. I believe she had a pulmonary embolism, if I'm not mistaken, and barely survived her pregnancy. How can, what's the cause of these disparities? And then how can we begin to disrupt and dismantle them?
The cause, so here's the thing, 63% of maternal deaths are preventable, right? Like the majority of them are preventable. The cause is racism. That's really what it is. And so we, in the medical community, in the public health community, we like to water it down and call it implicit bias, that they're implicitly biased. No, it's explicit racism. I gave a talk earlier this week, and a sister that was on a panel with me, Dr. Kindred, she's a dermatologist in Maryland, she called it explicit racism instead of implicit bias. I was like, I'm using that because that's exactly what it is, right? Explicit racism. And so we see providers are less likely to spend time with Black patients. They're less likely to take our symptoms serious. They're less likely to think that, what we're describing is of urgency. And really what kills women in pregnancy and postpartum, to be honest with you, is the delays. Not that we don't know what to do, not that we don't have the life-saving technology. It's when a woman is in labor and she starts to have complications, the delays in escalating her case. When a woman is immediately postpartum, when she's having a C-section and she's starting to hemorrhage, the delays in escalating her case. What do we do? Oh my gosh, she's bleeding out. All that delay and that bias is really like hampering the situation. We see it time and time and time again. So the case of Serena Williams that you just referenced, world-class athlete. She's not delivering in a mom and pop hospital. Amazing resources. She delivered and was postpartum, and she said, I think I need to get a CT scan. And the nurse was like, oh, just go back and lay down. You're just confused. Now, for those of us that have had a baby, yes, you're tired, but you're not confused, right? You still are. So when the nurse started to go lay down because she was confused, she said, no, I was getting treated for pulmonary embolism, but I had to stop the medication because I was pregnant. I think I need a CT scan. And if she had not pushed and pushed and pushed, she would not have gotten it. She had a blood clot that was forming in her lung that could have killed her. Now, what type of stain is that on the fabric of the American healthcare system for us to lose a global superstar to racism, to the dismissiveness of her feelings? So Serena is it's a national case. It's an international case. Beyonce talks about it. She had preeclampsia with her twins, also a very dangerous condition of pregnancy. And so I'm happy for the women that are getting the traction, but I'm also here for the women that are not getting that traction, right? Like Dr. Shanice Wallace, may she rest in peace. She's a pediatric resident that died about a month ago in Indiana. Again, preventable complications of preeclampsia. So what we're describing is the cumulative impact of racism on a broken healthcare system. It was not designed by us, right? If we go back to the father of gynecology, we know that the procedures that women enjoy today, getting a pap smear, having a speculum, knowing what we know about cervical cancer, the cervix, the uterus, those techniques, those methods were perfected on the bodies of Black female slaves. No anesthesia, no consent. So we're in a system that was not developed for us or to benefit us or to even keep us in mind as you're developing these things, right? And I like to say their names when I give these talks because I want to give life to these women, Betsy, Lucy, and Anarcha. These are 3 female slaves that paved the way for all women today to enjoy the benefits. That's how we know how big a speculum is supposed to be. That's how we know how to do these procedures, because they were perfected on Black bodies. So how as Black women are we supposed to feel comfortable and feel safe in a system that was not designed for us? And we're still seeing the implications of that today with these preventable maternal deaths.
That's a powerful history lesson. And thank you for saying their names. We have these people, these were human beings, they were lives. And it's important that we remember them and carry that forward.
Yes.
Tell us about the Mother Lab. Tell us what Mother stands for. And I know you said you have a team of 36 brilliant people. I would love to hear from your colleagues here about the roles they each play in the Mother Lab as well.
Absolutely. So Mother stands for Maternal Outcomes for Translational Health Equity Research. And Mother Lab was really born this summer just out of a necessity to address this issue. I give a lot of talks on maternal health disparities. I'm plugged in at the state and local and federal levels. And so people are always asking me, I want to get connected to your work. How can I support what you're doing? And so it became a groundswell of brilliant students who want to address this. And the beauty of Mother Lab is that we have everybody included. We have undergrad, masters, PhD, MDs. We have all backgrounds, races, ethnicities, and there's space for everyone to address this issue. And so I'll let the ladies at the Mother Lab talk, but that's really the impetus for it. Was I kept getting these requests from this student and this student and this student. I want to be mentored by you. I want to work with you. I want to help out what you're doing. I said, okay, I need a way to manage this, but also provide this large body of students with access to me, because I can't do it piecemeal. And we're stronger in numbers, right? And what we've been able to build and what we're planning for 2021 and thereafter is just going to change the landscape around maternal health disparities in the field of research and policy. But I would love to hear you guys introduce yourselves and tell more.
Yeah, sure. So I'll hop on first. So I am a co-chair for the Research and Grants Committee within the Mother Lab. And so, as the title implies, we primarily are looking at implementing as much research as possible, doing as much research about maternal health and Black maternal health in particular, of course. And so my background, before the Mother Lab, I was studying the link between psychosocial stress and health outcomes. So, of course, one of those stressors is discrimination. And so it very neatly aligned with the kind of goals of Mother Lab. And I became a mother myself and actually had quite a traumatic experience as well. And so, and realizing that, the color of my skin really helped to determine my outcome. And that left a lasting impression on me. And so I knew that I needed to contribute to the lab and join this effort as soon as possible.
I'll go next. So hi again, I'm Brenna. I'm a MPH candidate at Tufts. And for Mother Lab, I am on the marketing and communications team. So I co-run the Twitter with Pega Malecki, who's not here today, but she's awesome. And our team is really just focused on making sure that everything that's happening internally is disseminated to the outside world so that we can actually make that impact and make those connections. And we also use our marketing and communications outlets to highlight and uplift other organizations that are doing similar work to us. So we want to make sure that our colleagues in the field are also getting the notoriety that they deserve. And I'm also involved with writing a manuscript on racism as a public health crisis with Keri. And what we're focusing on there is local policies versus national policies, and are they actually effective at addressing what they claim they're addressing? So that's my role within Mother Lab.
Hi, I'm Kelechi. I'm also working in the social media marketing committee along with Brenna. So to reiterate everything that she said, and how I got into the Mother Lab was basically I always had an interest in Black maternal mortality just through my experience working with one of the MDs at Tufts Med and going to a conference where we were having to talk about I forget the exact topic, but I remember but we were having to talk about mortality, and the presenter he put in a short quote that mentioned the large disparities between Black women and white women when it came to mortality rates. And then after the presentation, it seemed like a very just short and very just minute. He minimized the how big of a problem that it actually was. So through the doctor that I worked with, interning with her, and also a class I took at Tufts undergrad, I was able to get connected with Dr. Ao. And after emailing her a whole bunch and being I want to work with you, I really want to work with you, she introduced me to the Mother Lab, and that's how I got here.
Excellent. Thank you each for sharing your important role. It sounds like communication is a very important aspect of what you're doing at the Mother Lab, which is important. How are you guys leveraging communication channels, social media to really help disrupt and dismantle and really help empower women to confront the disparities that they face in this area?
Go ahead, Brenna.
Okay. I was just going to speak to my experience with the Twitter account. Pega and I, what we try and do is any research that pops up that happens to make its way to our group chat, we try and elevate that so that the following we have is informed on the most recent research we can find. We also try and stay connected with some of the organizations. Like off the top of my head, I'm thinking of the SASH Lab, and they're super cool. You guys should check them out as well. Just staying kind of in contact with other labs working on similar topics so that we can all make sure we're working towards the same goal in a cohesive and collaborative way.
Thank you. Yeah, I'll just add to that. And let me just give some context, Russell. The lab is like 5 months old. The lab, like we just started the lab July 15th. And so these young ladies are pumping. And one thing I'll say about communication is that this is such, it's such an opportune time to be working in this space. The federal government is putting a lot of resources behind it. I just received a large grant to do this work. I just saw something today, right before we got on, that another federal agency is dedicating resources and developing a national maternal health plan to reduce maternal mortality rates in half. I mean, it's a groundswell, and it's at a time of a precipice. So our job is to, one, be the leaders in the research space. I'm one of 6 nationally funded principal investigators doing this work. 2, to also be a voice for our local community. So the third community that we have is the community engagement, advocacy, and policy. So in addition to our marketing, in addition to our research, we have a whole committee dedicated to making sure we're a resource to the local community, making sure we keep our eyes to the local and state and national policy, and just being a resource to do community engaged work. And so that's some of the things that we're focused on. We're about to start our strategic planning process literally today. We have a lab-wide meeting, and the agenda is strategic planning, because I see Mother Lab as being, one, the largest training lab for students from undergrad to postdoc in the country, and 2, a tremendous opportunity. People coming out of Mother Lab are going to be OBs, they're going to be professionals in the field, they're going to be researchers, they're going to be applied public health people. And so we're going to permeate this disparities topic from a number of different.
You're sending people out from the lab are going to come and send out.
Exactly.
Beautiful. Okay.
It's a beautiful setup. So, Kelechi's an undergrad, Brenna's in a master's program, Keri already has her PhD. So that's 3 levels right there, 3 different disciplines, and just, being a resource to the community and being able to disseminate this work in multiple spaces.
Are there international implications for the work you're doing at all? Or any international connections that are working?
Yeah, we do have international connections. One project that we're working with now is called the OCOA project. So shout out to OCOA project. We have a couple students doing work with them. And I would be remiss if I didn't also mention that Mother Lab has like an undergrad version of us called March, which is an undergrad maternal and child health club that I'm the advisor for, and people in Mother Lab are also in March. But I bring up March because March is working directly with the OCOA project, which has projects right now in Tanzania, Kenya, Ghana, and we're starting a project in Nigeria focused on bringing ambulatory care services to rural parts of the country so women can get to delivery places safe and efficiently.
Right.
And we know that's another huge thing, thinking about the global implications of maternal mortality. Women are hemorrhaging on the way. Women are dying because they're delivering in their homes and they don't have the resources, or they don't have the conduits to get to the hospital. So the OCOA project, in collaboration with us, is trying to really facilitate that. We're doing some exciting work in Ghana, starting in Nigeria. I mean, COVID has put a damper on our timeline, but it's going to happen next year that we're going to be starting projects in the eastern part of Nigeria. So that's really exciting as well.
That is very exciting.
Yeah.
Of course, the obvious, but perhaps not so obvious question for me is, as a man, as a what can men do? How can we be more engaged and aware, supporters, or how can women partners be more aware in supporting and helping and ensuring that we have better outcomes for Black and brown women?
Yeah. That's a really good question. So I'm going to give a personal anecdote, and then I'll give like a research anecdote. So the personal anecdote is that, when I was pregnant with my son, when we were pregnant with my son, my husband and I remember we signed up for a birthing class at the hospital, and it was like a Saturday 9 to 5. And he was like, oh my gosh, it's going to be all day. Like, you have a PhD maternal child. Do we got to go to this class? And I'm like, yes, I'm a first time mom. We got to go to the class. And I made him come to the class because I said, all the other women in the class are going to show up with their husbands. Right. And so we walked into the class. We're the only Black couple getting this good knowledge, getting an insight inside tour of the hospital. They showed us birthing procedures. They showed us all this inside baseball to what to do when you get in labor. The only Black couple in the room. All the other white couples had their husbands sitting right there taking notes. I was like, you see why I needed you here? So we got to change the narrative that, Black men and Black fathers are absent from the conversation. That's first of all. Then professionally, I think we are doing there's a tremendous opportunity to engage men and fathers. They want to be supportive. I drag them to all my visits. You're going to hear the ultrasound just like me. You're going to ask questions just like me. If something is unclear, you're going to ask it right here. The doctor's going to be just as comfortable with me as they are with you, like changing their narratives and really giving fathers an opportunity to speak up because they feel like they're there to be in a supportive role, which they are, right? Rub our feet, rub our back. We carrying a baby, like it's hard. But at the end of the day, they're also tremendous advocates. There's one father in particular I want to lift up, Charles Johnson. He lost his wife. I don't know if you know about the Cure for Moms project out of California. His wife went in to deliver at a hospital. She had some complications and she ultimately died. But this father has lifted up the work of his wife and of maternal mortality. And so there's a tremendous kind of like new infusion of men coming to the table, taking leadership roles and being partners and husbands and providers and asking the questions. And in another separate project that I got, so I talked a little bit about the R1, which is funded by NIH. I also just got funded by Robert Wood Johnson Foundation. And in that project, we're really, really drilling down and focusing on the role of fathers. We're interviewing fathers. We're working in partnership with fathers. Fathers are going to be part of the research design because we want to know how we can better capitalize on this group of people that's here for the pregnancy, that's a part of the team, a part of the family, and that have not been fully acknowledged or utilized. So I have a whole separate project that's focusing on really centering the role of fathers and partners and really seeing how they can be partners in addressing this disparity.
Excellent. Well, it sounds like you have all your bases covered. Not that I'm surprised, one, as I'm listening and thinking about it and the implications of this important work, and being the father of two young daughters, of course, and thinking about their future, what their outcomes will be, is very exciting to hear.
Yes.
Kelechi or Brianna, can you tell us a little bit about where we can find you guys on social media? There's a website. Where can we learn more and keep up with the Mother Lab project that you guys roll out into 2021?
Yeah, so on Twitter, we're at MotherLab20, all caps. On Instagram, I believe it's just Mother Lab. And I know we have a LinkedIn and a Facebook running. I don't happen to know those links off the top of my head.
We'll find it and get it in the show notes.
Everything is on the website, www.motherlab.org.
Motherlab.org.
Yes.
I love it.
Yes.
Well, Dr. Keri Carvalho, Ms. Brenna Miller, Kelechi Offor, and Dr. Ndidiamaka Amutah-Onukagha, thank you so much for the important work you're doing. I know we're working on this for a couple months to get this scheduled. Thank you for taking the time. I know it's the end of the semester for interview, and we're dealing with COVID uptick. I know some of you are directly dealing with that from a professional level. Thank you so much for making time and being a guest today on the Necessary Trouble Show.
Thank you so much for having us. Thank you all. Take care.
Thank you.
Thanks for watching the Necessary Trouble Show. Please visit necessarytroubleshow.com to support the show and to learn more. Subscribe to our e-newsletter and podcast, and follow us on social media at Necessary Trouble Show.
Good job, Daddy. This is Paige. Thanks for watching.